Hello everyone, and welcome to today's lecture. My name is Dr. Fahmy, and I'm thrilled to have you here as we dive into a fascinating topic in neuroscience, understanding the central nervous system, depressants, and stimulants. Today, we'll explore how these substances interact with the brain and body, influencing our mood, perception, and behavior. So, grab your notes, stay curious, and let's embark on this journey to unravel the complexities of the human brain. Let's get started. Let's start with an overview of the central nervous system, or CNS. The CNS consists of two key components, the brain and the spinal cord. Both are protected by tough tissues called meninges and surrounded by cerebrospinal fluid, which acts as a cushion, providing vital protection against physical impact. Think of the CNS as the command center of the body. The brain processes information and makes decisions, while the spinal cord acts as a communication highway, transmitting signals between the brain and the rest of the body. Together, they control our movements, emotions, and all bodily functions. Understanding this system's structure is key to appreciating how it works and how various substances influence its activity. The brain is an incredible organ, divided into several specialized parts, each with unique functions. It's protected by a layer of gray matter, which gives it its distinct wrinkled appearance with gyri and sulci, or ridges and grooves. At the core, the brain is divided into two hemispheres, left and right, and into lobes. Each lobe has a specialized role. The frontal lobe manages personality, speech, and logical reasoning. The parietal lobe is key to sensory reception and spatial reasoning. The occipital lobe handles vision, and the temporal lobe governs hearing and receptive language. Deep within lies the limbic system, our emotional center, responsible for feelings and short-term memory. This intricate coordination among the brain's parts ensures we can think, feel, and react seamlessly. Now, let's dive deeper into specific brain regions. The cerebrum, the largest part of the brain, is a hub for advanced functions. Its surface, covered in gray matter, enables complex processing. The cerebrum's hemispheres are divided into four lobes. The frontal lobe, which guides personality, speech, and logical thinking. The parietal lobe, responsible for sensory processing and spatial awareness. The occipital lobe, where visual interpretation happens. And the temporal lobe, handling auditory information and language understanding. Together, these regions make the cerebrum essential for conscious thought, decision-making, and emotional expression. Without its intricate coordination, our advanced human functions wouldn't be possible. Cerebellum, located at the back of the head, just below the occipital lobe, is the cerebellum, a smaller but crucial part of the brain. It resembles the cerebrum with its hemispheres and white matter interior, often called the tree of life due to its appearance. The cerebellum's primary role is coordination and balance. It ensures our movements are smooth and precise, helping us maintain posture and perform everyday activities seamlessly. For example, when walking or writing, the cerebellum fine-tunes your actions, making them fluid and effortless. The brain stem, at the base of the brain, is one of the most primitive and vital structures. It connects the brain to the spinal cord and controls many automatic functions essential for survival. It has three parts: the pons, which acts as a bridge between different parts of the nervous system. The midbrain, regulating reflexes and contributing to sight and hearing. The medulla oblongata, responsible for life-sustaining functions like heart rate, blood pressure, and respiration. Without the brain stem, many of the body's vital processes would cease, making it a cornerstone of the central nervous system. The spinal cord extends from the occipital bone to the second lumbar vertebra, serving as a key communication highway. Unlike the brain, it has white matter on the outside and gray matter on the inside. The spinal cord performs two critical roles. It relays messages between the brain and the body and acts as a reflex arc for immediate reactions. For example, if you touch something hot, the spinal cord triggers a reflex action before your brain processes the sensation, ensuring quick responses to danger. CNS depressants are a class of drugs that slow down brain activity. This effect leads to relaxation of the muscles and a calming of the mind. These medications are often prescribed to treat conditions like insomnia, anxiety, panic attacks, and seizures. In some cases, they are even used to reduce anxiety before surgical procedures. Common examples of CNS depressants include benzodiazepines, barbiturates, and certain sleep medications. Because of their ability to alter brain activity, it's important that these drugs are used responsibly, as improper use can lead to dependency or other health complications. Now, let's delve into the two primary types, opioids and non-opioids. Opioids are among the most powerful CNS depressants, known for their ability to alleviate severe pain. They achieve this by binding to opioid receptors in the brain and spinal cord, altering the perception of pain and inducing a state of numbness or unconsciousness. Examples of opioids include morphine, methadone, and heroin. While these drugs are incredibly effective for pain relief, they come with a significant risk of addiction. It's also worth noting that opioids act mainly at the cortical level of the CNS, affecting not just pain perception but also emotional states, which contributes to their euphoric effects. Non-opioid depressants work differently from opioids. Instead of targeting opioid receptors, they inhibit enzymes like COX-1 and COX-2, leading to a decrease in the release of inflammatory mediators such as prostaglandins. These drugs, including aspirin and ibuprofen, are typically used to treat mild to moderate pain and have a much lower risk of addiction. Their primary site of action is the thalamus and hypothalamus, making them effective for conditions like headaches and muscle pain. Unlike opioids, non-opioids don't induce significant sedation, which makes them safer for everyday use. Let's take a closer look at morphine, one of the most well-known opioids. Morphine is derived from opium, the dried juice of the poppy plant, and is considered the prototype of opioid drugs. It binds to opioid receptors in the CNS, reducing the transmission of pain signals. Morphine is highly effective, particularly for severe pain, but it also comes with limitations. For instance, when taken orally, its effectiveness is reduced due to first-pass metabolism in the liver. It's primarily used in cases like surgery, terminal cancer pain, or myocardial infarctions. However, its use must be carefully managed due to the risks of dependence and tolerance. Morphine's action is closely tied to its interaction with opioid receptors, which are linked to G-protein receptors. Here's what happens. Morphine decreases CAMP levels, leading to the opening of potassium channels and hyperpolarization of neurons. This hyperpolarization inhibits the transmission of sensory signals, effectively blocking pain perception. Additionally, morphine inhibits the opening of calcium channels, further reducing neurotransmitter release. This dual mechanism explains its powerful analgesic effects. However, these same mechanisms can also lead to side effects, such as respiratory depression and constipation. Morphine has a wide range of therapeutic applications due to its potent pain-relieving properties. It's commonly used for relieving pain during surgeries or obstetric procedures, managing severe pain in terminal cancer or myocardial infarctions, reducing dyspnea caused by pulmonary edema, treating severe diarrhea in specific cases. Despite its benefits, the use of morphine must always be balanced against its potential side effects and risk of addiction. Morphine has a profound impact on various body systems. On the cardiovascular system, it can cause postural hypertension due to peripheral vasodilation, which may be linked to histamine release. In the endocrine system, morphine increases prolactin and vasopressin secretion, while reducing stress-related hormones like LH and FSH. It also affects the gastrointestinal tract, reducing motility and causing constipation, a side effect to which tolerance does not develop. On the central nervous system, morphine produces analgesia, euphoria, sedation, and respiratory depression. Other effects include facial warmth, itching, and an increase in intracranial pressure. These systemic effects highlight the need for careful monitoring during its use. Morphine's adverse reactions stem from its powerful influence on the CNS and other body systems. Respiratory depression is the most serious side effect, potentially leading to apnea if not managed. Other issues include nausea, vomiting, and dizziness, often coupled with orthostatic hypotension. Mental clouding and drowsiness are common, while gastrointestinal side effects like constipation and biliary spasms can cause significant discomfort. Morphine may also result in urinary retention, dry mouth, and hypersensitivity reactions such as dermatitis or urticaria. Long-term use can suppress the immune system, increasing the risk of recurrent infections. Using morphine requires strict precautions due to its potential risks. Patients with conditions like respiratory disorders, such as COPD, are at heightened risk of respiratory depression. Morphine can also exacerbate orthostatic hypotension and histamine-induced asthma symptoms. Its interactions with other CNS depressants amplify sedative effects, while tolerance and dependence may develop with prolonged use. For patients with liver disease, impaired metabolism can lead to drug accumulation, increasing toxicity risks. Additionally, morphine's ability to elevate intracranial pressure necessitates caution in patients with head injuries or cerebral conditions. Barbiturates are a class of drugs that depress the CNS to varying degrees, depending on the dose. These drugs are used as hypnotics, sedatives, anticonvulsants, and for surgical anesthesia. Introduced in 1903, barbiturates were initially a popular choice for treating insomnia and anxiety, but are less commonly used today due to the availability of safer alternatives like benzodiazepines. Their narrow therapeutic index means the margin between effective and toxic doses is small, which can lead to overdose risks. Barbiturates work by enhancing the effects of GABA in the brain, inhibiting nerve impulses and leading to sedation, respiratory depression, and, in severe cases, coma. Barbiturates function by enhancing the activity of GABA, the brain's primary inhibitory neurotransmitter. They bind to GABA-A receptors, prolonging the opening of chloride channels and hyperpolarizing neurons. This inhibits nerve impulse transmission, particularly in the cerebral cortex and brainstem. The sedative effects range from mild drowsiness to deep anesthesia, depending on the dose. However, excessive use can lead to respiratory depression, hypertension, and coma, highlighting the importance of precise dosing. Benzodiazepines are among the most frequently prescribed sedative hypnotics due to their efficacy, safety profile, and wide therapeutic applications. These drugs enhance the effect of GABA, leading to calming effects without significant sedation at low doses. Benzodiazepines are used to treat anxiety, insomnia, epilepsy, and alcohol withdrawal. Their quick onset of action and reduced risk of overdose compared to barbiturates make them a preferred choice in clinical practice. However, long-term use can result in dependency, necessitating careful monitoring. Therapeutic uses of benzodiazepines. The versatility of benzodiazepines allows them to be used in various conditions. They serve as anxiolytics, reducing anxiety and agitation. In higher doses, they act as hypnotics, promoting sleep. They are also muscle relaxants and anticonvulsants, particularly useful in managing epilepsy and seizure disorders. In surgical settings, benzodiazepines are used for pre-anesthesia and sedation. They are even employed to mitigate symptoms of alcohol withdrawal. Despite their broad applications, their potential for dependency requires cautious prescribing. CNS stimulants are drugs that enhance the activity of the brain and spinal cord. They increase the levels of certain chemicals, such as dopamine and norepinephrine, which elevate mood, boost alertness, and increase energy. These effects make them valuable in treating conditions like ADHD and narcolepsy. However, misuse can lead to overstimulation, resulting in restlessness, insomnia, and in severe cases, convulsions or cardiovascular issues. Understanding their controlled use is crucial for maximizing benefits while minimizing risks. CNS stimulants produce distinct effects on both the mind and body. Individuals using these substances often experience elevated mood and increased motor activity, which may manifest as restlessness or hyperactivity. There's also heightened alertness, allowing for extended periods of focus and productivity, often accompanied by a reduced need for sleep. However, these seemingly beneficial effects come with risks. Overuse or overdose can lead to severe consequences such as convulsions, tremors, or even life-threatening conditions like cardiovascular collapse. Recognizing these symptoms early is crucial for intervention and safe management of stimulant use. CNS stimulants are broadly categorized into three classes: analeptic stimulants, psychomotor stimulants, and methylxanthines. Analeptic stimulants, which include drugs with short durations of action, act to stimulate the central respiratory and motor centers, often used in emergency settings. Psychomotor stimulants like amphetamines and cocaine enhance dopamine and norepinephrine activity, resulting in heightened energy, alertness, and euphoria, though with a high risk of addiction and overdose. Methylxanthines, such as caffeine, block adenosine receptors and alter calcium distribution within cells, producing mild stimulation suitable for everyday use. Each category serves distinct therapeutic and recreational purposes, highlighting their varied impacts on the CNS. Amphetamines are potent CNS stimulants that increase alertness, suppress appetite, and reduce fatigue. They achieve these effects by activating the sympathetic nervous system and boosting levels of dopamine and norepinephrine in the brain. Clinically, amphetamines are used to treat conditions such as ADHD, narcolepsy, and, occasionally, obesity. However, their stimulating effects can lead to side effects like insomnia, irritability, and cardiovascular disturbances, including arrhythmias and hypertension. Their potential for misuse and dependency requires careful prescribing and monitoring. Amphetamines, while effective in therapeutic doses, can cause significant adverse effects when misused or taken in excess. Common side effects include insomnia, irritability, and feelings of restlessness. At higher doses, they may lead to palpitations, arrhythmias, and hypertension, posing risks to cardiovascular health. Gastrointestinal disturbances, including nausea and diarrhea, are also reported. Chronic use may exacerbate mental health issues, leading to dependency and withdrawal symptoms. Proper management and responsible use are essential to minimize these risks. Cocaine is one of the most powerful CNS stimulants, known for its immediate and intense euphoric effects. It works by blocking the reuptake of dopamine, resulting in prolonged stimulation of the brain's reward centers. While this creates a temporary sense of exhilaration and heightened awareness, it is also the foundation for its highly addictive nature. Medically, cocaine is used sparingly as a local anesthetic during certain surgical procedures, such as in ENT surgeries, due to its ability to block sodium channels and prevent nerve conduction. However, its widespread abuse and significant health risks limit its clinical applications. Cocaine's therapeutic applications are limited but precise. Its primary use is as a local anesthetic in eye, ear, nose, and throat surgeries. This is due to its ability to block voltage-activated sodium channels, which numb specific areas while also causing localized vasoconstriction, reducing bleeding during surgical procedures. Its use is strictly controlled and reserved for these specific scenarios to mitigate the risks associated with its systemic effects. Cocaine's stimulating effects are tied to its ability to block dopamine reuptake, enhancing its availability in synaptic spaces. This action produces euphoria, heightened alertness, and increased energy. At therapeutic doses, it provides localized anesthesia by blocking sodium channels, but at higher doses, it leads to severe CNS stimulation. Overuse can result in dangerous side effects, including hallucinations, convulsions, and respiratory depression. Additionally, cocaine's activation of the sympathetic nervous system may cause hypertension, tachycardia, and hypothermia, making it a drug with high risks alongside its intense effects. Cocaine's adverse effects highlight the dangers of its abuse. Psychologically, it can cause anxiety, depression, agitation, and paranoia. Neurologically, seizures are a severe risk, while cardiovascular effects like arrhythmias and myocardial infarction can be fatal. Chronic use depletes dopamine levels in the brain, leading to dependency and intense cravings. The overstimulation of the sympathetic nervous system further contributes to long-term complications like hypertension and hypothermia. These adverse effects make cocaine a substance of concern, requiring strict control and caution in its use. Thank you all for your attention today. We've explored the fascinating world of the central nervous system, its depressants and stimulants, and how these substances impact the intricate workings of the brain and body. I hope this session has deepened your understanding and sparked your curiosity to learn more. Remember, knowledge of these systems is not just academic. It's essential for making informed and responsible decisions. Until next time, stay curious and take care.